When you stop eating gluten for 21 days, you are not following a wellness trend. You are giving your immune system permission to stand down from a war it may have been fighting inside your intestinal wall every single day for years, possibly your entire life. Imagine a border checkpoint built inside your small intestine. Its job is to decide what crosses from your gut into your bloodstream. Nutrients in, waste out. When the checkpoint is functioning, it is precise and impenetrable. Nothing passes without authorization. Now imagine that a specific protein, one found in wheat, barley, and rye, arrives at the checkpoint and begins dismantling the gate. Not all at once, slowly, brick by brick, junction by junction. The checkpoint does not sound an alarm. There is no pain signal, there is no fever, there is no obvious sign that the gate is coming apart. But behind it, the bloodstream is now receiving things it was never designed to process: partially digested food proteins, bacterial fragments, and inflammatory signals. And the immune system begins responding to every single one of them. This isn't just a metaphor. This is the mechanism of gluten-driven intestinal permeability, documented in peer-reviewed research, operating silently in a far larger percentage of the population than any official guideline has yet acknowledged. The checkpoint was not always this vulnerable. Before industrial wheat breeding, modern wheat contained significantly lower concentrations of the specific gliadin proteins responsible for tight junction disruption. Modern high-yield wheat varieties, developed from the 1960s onward, contain dramatically elevated gliadin content compared to ancient grains. The gate was not always being dismantled. The key that dismantles it became far more powerful in the last 60 years. Now imagine what happens the moment you remove the dismantling protein. The gate begins to reassemble. The checkpoint tightens. The immune system receives fewer foreign signals. And for the first time in possibly years, your intestinal barrier begins doing the one job it was always designed to do. That is what these 21 days are. Not a fad, not a restriction, a ceasefire, an opportunity for the most critical border in your body to repair itself, and for every system that depends on that border to begin functioning the way it was designed to. Today we are covering 5 things: what gluten is actually doing inside your body right now, the 21-day biological timeline day by day, the 10 hidden effects nobody connects to gluten, why the medical and food industries have kept this science from reaching mainstream understanding, and 3 pro tips for removing gluten without making it harder than it needs to be. Stay until the effects section: the brain fog, the joint pain, the skin conditions, the autoimmune flares. Every single one of it may connect back to what is in your bread. Let's start the clock. Before the clock starts, you need to understand what gluten is doing inside your body right now, because this is not about intolerance. This is about a molecular mechanism that affects intestinal function in every human who consumes it, not just the diagnosed minority. Gluten is a protein composite found in wheat, barley, rye, and most oats through cross-contamination. When you eat gluten, your digestive enzymes cannot fully break it down. Unlike most proteins that digest into individual amino acids, gluten breaks into peptide fragments, specifically a sequence called gliadin, that remain biologically active inside your small intestine. These gliadin peptides trigger the release of a protein called zonulin, discovered by gastroenterologist Alessio Fasano and his team at Harvard Medical School in 2000. Zonulin is your body's primary regulator of intestinal tight junctions, the molecular bolts that hold your gut lining cells together and control what passes into your bloodstream. When gliadin binds to its receptor on the intestinal surface, zonulin is released, and zonulin opens the tight junctions. This is not a disease process specific to celiac sufferers. This is a normal biological response that occurs in every human intestine upon gluten exposure. Fasano's research demonstrated that gliadin triggered zonulin release and measurable tight junction opening in all human intestinal tissue samples tested, not just in those with celiac disease. The difference between a celiac patient and a non-celiac individual is not whether the gate opens. It is how dramatically it opens and how long it takes to close. With tight junctions open, the intestinal barrier becomes permeable. Partially digested gliadin peptides, bacterial endotoxins, specifically lipopolysaccharides from gram-negative gut bacteria, and other luminal contents cross into the bloodstream. Your immune system identifies these as foreign. It mounts a response. Inflammatory cytokines are released. Antibodies are produced. And because these gliadin peptides share structural similarity with proteins found in multiple human tissues, the thyroid, the cerebellum, the synovial joints, the immune response can become cross-reactive. The immune system, trying to attack the foreign gliadin peptide, begins attacking tissues that look like it. This is called molecular mimicry. It is the mechanism by which gluten consumption has been linked to Hashimoto's thyroiditis, rheumatoid arthritis, cerebellar ataxia, psoriasis, and multiple other autoimmune and inflammatory conditions in the peer-reviewed literature. Simultaneously, the inflammatory state driven by chronic intestinal permeability disrupts the gut microbiome, impairs nutrient absorption, particularly of iron, B12, folate, magnesium, and vitamin D, and drives the production of inflammatory signaling molecules that cross the blood-brain barrier and produce neuroinflammation. The gate has been open. Every meal containing gluten has been opening it, until you remove the key. Now the clock begins. Here is exactly what happens inside your body, day by day, when you remove gluten. In the first 1 to 3 days, gluten is clearing your system. The transit time of food through the small intestine is approximately 24 to 48 hours. By day 2 to 3, the gliadin peptides from your last gluten exposure have passed through, and the direct tight junction disruption from that exposure has begun to resolve. Zonulin levels begin falling. The acute opening of tight junctions from the last exposure starts to close. This is the first biological event of the 21 days. Not yet repair, but the cessation of active disruption. The dismantling of the gate has stopped. Many people do not feel this. Some people notice a subtle reduction in bloating within 48 to 72 hours as the direct intestinal irritation from gliadin peptides reduces and the inflammatory signaling begins to quiet. This is not placebo. Gliadin peptides have a direct irritant effect on intestinal tissue independent of the immune response they trigger. If you push through this, a fascinating shift occurs. By day 3 to 7, with zonulin levels continuing to drop in the absence of new gliadin exposure, the tight junction proteins, specifically occludin and claudins, begin the process of resealing. The molecular gate begins to reassemble. This is a structural repair process. The cells that line your small intestine, enterocytes, have a lifespan of approximately 3 to 5 days. By day 7, a significant proportion of the enterocytes in your small intestine have been replaced by new cells that have formed and matured in the complete absence of gliadin disruption. These new cells can establish tight junctions at their full structural integrity, junctions that have not been continuously disrupted by zonulin release. Intestinal permeability begins to measurably reduce. The volume of bacterial endotoxins crossing into the bloodstream decreases. The chronic immune activation driven by continuous endotoxin exposure begins to quiet. Many people report the most significant early changes in this window: reduction in bloating that was so habitual it had become their baseline, improvement in bowel regularity, and the beginning of a reduction in the low-grade fatigue that characterizes chronic, low-level systemic inflammation. But here is where the science gets truly shocking. Now we arrive at the most important immune shift of the 21 days. By day 7 to 14, with intestinal permeability reducing, the volume of foreign antigens arriving in the bloodstream is decreasing. The immune system, which has been running on continuous alert from the chronic endotoxin and gliadin peptide load, begins to stand down. Inflammatory cytokine levels begin to drop measurably. C-reactive protein, the primary marker of systemic inflammation, begins to reduce. The innate immune system begins transitioning from a constant activation state toward a maintenance and surveillance state. The inflammatory background noise that has been suppressing immune precision begins to quiet. Nutrient absorption begins recovering simultaneously. The enterocytes lining the small intestine carry microvilli, microscopic finger-like projections that massively increase the absorptive surface area and carry the transport proteins responsible for absorbing iron, B12, folate, calcium, magnesium, and fat-soluble vitamins. Gliadin-driven inflammation causes villus atrophy, flattening and destruction of these microvilli, in a spectrum that extends well beyond diagnosed celiac disease. A 2017 study published in Gut demonstrated that non-celiac gluten sensitivity produces measurable increases in intestinal permeability and villus damage markers, even in the absence of the specific autoantibodies that define celiac disease. As inflammation reduces and new enterocytes establish undisrupted microvilli, nutrient absorption begins recovering. Iron absorption improves, magnesium uptake increases, B12 transport normalizes. Many people notice this as an improvement in energy quality and a reduction in the anemia-adjacent symptoms, pale fatigue, cold extremities, poor concentration, that they had attributed to other causes. But here is where the science gets truly shocking. By days 14 to 21, the compounding effects of improved gut barrier integrity, reduced endotoxin load, improved nutrient absorption, and quieting immune activation begin to produce measurable changes beyond the digestive system. Neuroinflammation begins to reduce. The gut-brain axis, the bidirectional communication highway between the gut microbiome and the central nervous system, has been carrying a high volume of inflammatory signal from the chronically permeable intestine. Bacterial endotoxins crossing the gut wall enter the bloodstream, cross the blood-brain barrier, and activate microglial cells, the brain's resident immune cells, producing neuroinflammation that impairs cognitive function, mood regulation, and neurological signaling. As intestinal permeability reduces and the endotoxin load drops, microglial activation begins to quiet. Brain fog, perhaps the most consistently reported symptom of gluten sensitivity, begins to lift. Research published in Alimentary Pharmacology and Therapeutics in 2019 documented significant improvements in cognitive performance, brain fog scores, and fatigue measures in non-coeliac gluten sensitivity patients within 3 weeks of gluten removal. The thyroid begins to respond. In individuals with Hashimoto's thyroiditis, the most common autoimmune thyroid condition, gluten-driven molecular mimicry has been producing cross-reactive immune attacks on thyroid tissue. As the immune response to gliadin quiets, the cross-reactive attack on the thyroid begins to reduce. A 2019 study published in Frontiers in Endocrinology found that a strict gluten-free diet for 6 months in Hashimoto's patients produced significant reductions in thyroid antibodies, a measurable reduction in the autoimmune attack on the thyroid gland. The first signs of this improvement begin to register within 3 weeks. Your skin begins to change. Dermatitis herpetiformis is the skin expression of gluten-driven immune activation, but the mechanism extends to broader skin inflammatory conditions, including psoriasis and eczema, through the endotoxin-driven systemic inflammation pathway and the direct effect of nutrient malabsorption on skin cell renewal. As both pathways begin improving, skin inflammatory markers reduce. Your joint pain begins to respond. The synovial fluid in your joints is directly affected by the circulating inflammatory cytokines produced by gluten-driven intestinal permeability and molecular mimicry. As cytokine levels drop across days 14 to 21, the synovial inflammatory environment begins to calm. Many people report the first noticeable reduction in baseline joint stiffness and pain in this window. The checkpoint is resealing. The immune system is standing down. The systems that were running on continuous inflammatory alert are beginning, for the first time, to recalibrate toward their designed baseline. Now the 10 effects. Every single one is something you have been living with and blaming on the wrong cause. Effect 10. The chronic bloating and abdominal discomfort you blame on eating too much, eating too fast, or irritable bowel syndrome. Gliadin peptides have a direct irritant effect on intestinal tissue and trigger zonulin-mediated tight junction opening that causes intestinal edema, local tissue swelling. The bloating is not from the quantity of food. It is from the intestinal response to a specific protein in the food. Remove gluten for 72 hours and the direct gliadin irritation ceases. Remove it for 7 days and the tight junctions begin resealing. The bloating that you have accepted as your normal begins to resolve. Effect 9. The persistent headaches and migraines you blame on stress, dehydration, or hormones. Gluten-driven intestinal permeability allows bacterial endotoxins to enter the bloodstream and cross the blood-brain barrier, activating the neuroinflammatory cascade that produces vascular changes implicated in migraine. A 2012 study published in Neurology found that celiac patients had a significantly elevated prevalence of migraine and that a gluten-free diet reduced migraine frequency. The mechanism extends to non-celiac gluten sensitivity through the same intestinal permeability pathway. Effect 8. The joint pain and stiffness you blame on age, exercise, or weather. The molecular mimicry mechanism produces cross-reactive immune attacks on synovial tissue in genetically susceptible individuals. Additionally, the systemic inflammatory cytokine load from chronic intestinal permeability directly elevates the inflammatory environment of every joint in your body. Remove the trigger, reduce the cytokine load, and joint inflammation begins to recalibrate. Effect 7. The fatigue that sleep does not resolve. Gluten-driven intestinal permeability produces three simultaneous energy-depleting mechanisms. Iron and B12 malabsorption from villus damage impairs oxygen carrying capacity and mitochondrial function. Chronic immune activation consumes significant metabolic resources that would otherwise be available for energy production. And neuroinflammation from endotoxin exposure directly impairs the brain's arousal and energy regulation systems. The fatigue is not laziness. It is three simultaneous metabolic drains operating continuously. Effect 6. The brain fog and cognitive impairment you blame on stress, age, or poor sleep. Neuroinflammation from gluten-driven intestinal permeability directly impairs hippocampal function, the brain region responsible for working memory, learning, and cognitive processing. A specific condition called gluten ataxia, documented by neurologist Marios Hadjivasiliou at the University of Sheffield, demonstrates the direct cerebellar neurological effects of gluten-driven immune activation in the absence of intestinal symptoms. The brain fog is not your baseline. It is an acquired neurological impairment from a dietary trigger. Effect 5. The skin conditions, psoriasis, eczema, dermatitis, chronic hives, you blame on genetics, environment, or unknown triggers. The systemic inflammatory cytokine load from gluten-driven intestinal permeability drives skin inflammation through two pathways: direct cytokine signaling to skin immune cells and nutrient malabsorption impairing the structural integrity of skin tissue. Multiple peer-reviewed case series document significant skin improvement in psoriasis and eczema following strict gluten removal, even in patients who tested negative for celiac disease on standard antibody panels. Effect 4. The thyroid dysfunction, hypothyroidism, Hashimoto's, subclinical thyroid abnormalities, you blame on genetics or age. Gliadin shares structural sequence similarity with transglutaminase 6, an enzyme found in thyroid tissue. When the immune system produces antibodies against gliadin transglutaminase complexes, those antibodies cross-react with thyroid tissue, producing the autoimmune thyroid destruction characteristic of Hashimoto's. This is not a theoretical mechanism. It is the documented explanation for why Hashimoto's patients show dramatically elevated rates of celiac disease and non-celiac gluten sensitivity compared to the general population. Effect 3. The hormonal disruption. Irregular cycles, PMS severity, fertility challenges, you blame on stress or genetics. Nutrient malabsorption from gluten-driven villus atrophy reduces the availability of magnesium, zinc, and folate, all critical for hormonal synthesis and regulation. Simultaneously, the systemic inflammation from intestinal permeability elevates cortisol, the body's stress hormone, which directly suppresses reproductive hormone signaling through the hypothalamic pituitary gonadal axis. The hormonal disruption has a gut-level origin that has never been investigated. Effect 2. The anxiety and depression that therapy and medication have not fully resolved. Your gut produces 90% of your serotonin and significant quantities of GABA. Gluten-driven intestinal permeability and dysbiosis disrupts both production pathways. Neuroinflammation from endotoxin crossing the blood-brain barrier directly impairs the hippocampal neurogenesis that is the biological basis of antidepressant efficacy. A 2014 study published in Alimentary Pharmacology and Therapeutics found that gluten exposure in non-celiac gluten-sensitive individuals produced significant increases in depression scores through a biological pathway completely independent of intestinal symptoms. The depression and anxiety had a dietary driver that was never identified. Effect 1. The autoimmune condition. Hashimoto's, rheumatoid arthritis, lupus, multiple sclerosis, psoriasis, that you have been told is genetic, incurable, and requires lifelong management. Every autoimmune condition involves the immune system attacking the body's own tissue. Molecular mimicry from gluten-driven gliadin peptide exposure gives the immune system a repeated target, a continuous trigger for autoantibody production that persists with every meal containing gluten. Remove the trigger, and the autoimmune attack loses its primary stimulus. The checkpoint closes. The immune system stops receiving the signal that was driving it to attack. Not a cure, not a guarantee, but a removal of the primary dietary trigger that has been continuously feeding the autoimmune process. And for the first time, the immune system gets the ceasefire it was never given. The gate closes. The checkpoint stands down. And the body gets to begin the most important work it has always been trying to do. Now here is the part that should make you angry. Gluten sensitivity, in its full non-celiac spectrum, was not recognized as a legitimate medical category until 2011, when the first international expert consensus panel published a definition of non-celiac gluten sensitivity in the journal BMC Medicine. Before 2011, if you tested negative for celiac disease antibodies and had a normal intestinal biopsy, you were told that gluten was not your problem. Full stop. The millions of people experiencing real biological symptoms from gluten exposure were told their symptoms were psychological, stress-related, or attention-seeking. Decades of real suffering were dismissed because the diagnostic category did not yet exist in the medical textbooks. The global wheat industry, including major commodity trading companies, industrial milling operations, and bread manufacturers, is collectively worth over $800 billion annually. Wheat is the second most produced grain on Earth. It is the foundational ingredient of the majority of processed food products in every developed nation. A mainstream medical acknowledgement that wheat gluten causes measurable biological harm beyond the diagnosed celiac minority, which represents only 1 to 2% of the population, would represent a category-level threat to one of the largest food commodity markets in existence. The research into non-celiac gluten sensitivity has been systematically underfunded relative to its clinical significance. Fasano's Zonulin research was published in 2000. The mechanism by which gluten opens intestinal tight junctions has been known for over 2 decades. Yet the vast majority of gastroenterologists, general practitioners, and dietary guideline bodies still do not routinely screen for or acknowledge non-celiac gluten sensitivity as a first-line consideration in patients presenting with the full spectrum of symptoms it produces. The pharmaceutical industry generates significant revenue from the symptomatic management of every condition that gluten-driven intestinal permeability drives. Proton pump inhibitors for gut symptoms, biologics for autoimmune conditions, antidepressants for neuropsychiatric symptoms, thyroid hormone replacement for Hashimoto's hypothyroidism, and NSAIDs for joint inflammation. A dietary intervention that reduces the primary driver of these conditions is not in the commercial interest of any of the industries managing their downstream effects. They did not hide this because the science was wrong. They hid it because the science works. 3 tips for removing gluten without failing in the first week. Tip 1. Understand that gluten hides everywhere, and read every label. The most common failure in gluten removal is not intentional consumption, it is hidden exposure. Gluten is present in soy sauce, malt vinegar, beer, most processed meats, stock cubes, many sauces and condiments, medications and supplements with wheat-based binding agents, and any product manufactured in a facility that also processes wheat. Cross-contamination in shared cooking environments is sufficient to maintain intestinal permeability in sensitive individuals. A genuinely gluten-free 21-day trial requires reading every ingredient label of every product consumed. Look for wheat, barley, rye, malt, spelt, kamut, semolina, durum, triticale, and the phrase may contain wheat on any product. Oats require a certified gluten-free label due to cross-contamination in processing. If you cannot identify the ingredient source, do not consume it. Tip 2. Replace with whole foods, not gluten-free processed alternatives. The biggest mistake people make when removing gluten is replacing wheat-based products with gluten-free versions of the same products. Gluten-free bread, gluten-free pasta, gluten-free biscuits. These products are typically made from refined rice flour, tapioca starch, and potato starch. High glycemic index refined carbohydrates that drive blood glucose instability, provide no nutritional value, and in many cases contain emulsifiers and additives that cause their own gut disruption. The goal is not to reproduce the same dietary pattern without gluten. The goal is to replace grain-based foods with naturally gluten-free whole foods: rice, potatoes, legumes, vegetables, meat, fish, eggs, and fruit. These foods require no special labeling, are naturally complete, and provide the nutrient density that the gluten-damaged intestine needs to repair. Tip 3. Give it the full 21 days before evaluating. The most common reason people conclude that gluten removal does not work for them is that they evaluate the results at day 5 or day 7. The tight junction repair process, the reduction in chronic immune activation, and the recovery of nutrient absorption all operate on a timeline of weeks, not days. The most significant neurological and systemic improvements occur in week 3. Joint inflammation in particular requires at least 14 days of reduced cytokine load before measurable improvement is felt. Commit to the full 21 days with strict elimination before drawing any conclusions. One inadvertent gluten exposure, a single piece of bread, a soy sauce serving, a contaminated oat product, resets the tight junction disruption and extends the timeline of repair. The 21 days must be complete to be meaningful. 21 days, that is all they were betting you would never commit to without a diagnosis that nobody was testing for. You now know the bloating is intestinal edema from zonulin-mediated tight junction opening. The brain fog is endotoxin-driven neuroinflammation. The joint pain is molecular mimicry and cytokine load. The fatigue is 3 simultaneous metabolic drains. The autoimmune flare has a dietary trigger that has been continuous and unaddressed. You cannot be fooled by any of it anymore. Stop, repair, reclaim. You are not giving up bread. You are closing a gate that has been dismantled at every meal, that has been allowing your immune system to fight a war it was never meant to fight, against tissue that was never the enemy. If you are starting today, comment day 1 below. Every person who comments is someone else who now knows what zonulin is, what gliadin does to the gate, and why the ceasefire was never offered by any clinic they visited. And subscribe. Next, we are covering what happens to your body when you stop drinking alcohol for 30 days. The speed of neurological recovery will change how you think about every drink you have ever had. You need to see it before your next one.